Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, October 22nd, 2020. COVID update. So let's get right to the point tonight. We have 940 patients in the hospital. We had 1,650 some or 35 some patients today, one of our biggest, if not, I think, our second biggest day ever. And the weekend's coming and people are going to be getting together, so kind of a problem. So let's first talk about the hospitalization stuff. So we were pretty saturated at 770, 940, the hospital system's saturated. The governor kind of said Tuesday and then Wednesday, we're not saturated, we have plenty of staff. That is completely incorrect. Now, I'm going with that the governor isn't knowingly lying, because he wouldn't do that as a politician who's been in the know about how bad the situation is. But I am saying he's sadly uninformed, and since this is the greatest healthcare issue that's ever faced Oklahoma in modern history and pretty devastating to the economy and many things, perhaps he should know that the hospitals are full indeed. People are stacked up like cordwood in ERs waiting for beds. There's a massive nursing shortage, which has been very obvious and well documented. There's shortages of respiratory staff and all types of hospital staff. And then the concept that he's mentioning the Medical Reserve Corps, which I'll tell you what that is going to be on call or be available, is just, a fantasy. What is the Medical Reserve Corps? The Medical Reserve Corps are people who've been in medicine for a while or some length of time, usually a long time, who have retired. They're done. And so they join the Medical Reserve Corps on the off chance they may need to help something. They are probably extremely wonderful people, former doctors, former nurses, former respiratory techs, but they're a reserve corps. They're not going to be able to, one, fill in all the gaps across the state, because if they could do that, they should have been activated already, because there's huge gaps everywhere. Two, they're older people. They're not, the average age of the Medical Reserve Corps isn't 30 or 40. It's probably somewhere close to 60 or 65. And so they're older people who will get sick if they get COVID. So they're not the ones to call on right now. And they're probably not the ones who are going to answer the call that much either, because they're the wrong group to depend on in a COVID crisis. So and plus some of them, like one of the ones where I'm familiar, is a senior nurse executive. She has a full-time job besides being in the Medical Reserve Corps. So she can't drop her full-time job to run out and man a intensive care unit bed, which she hasn't done forever, when a call goes out to have them see if you're available. So the bottom line is, we're not being told the truth by the governor, and it may be inadvertent, and which is fine, but you should at least call him and say, hey, Governor Stitt, why do you learn the real statistics and what's going on in our state instead of making up fanciful things that aren't representational of the bed situation, the hospitalization saturation level, the staff shortages, etc. So, Kim, what's the number for the governor's office again?
It is 521
521 2342. 521 2342. 521 2342. Call tomorrow. It takes 2 minutes. Call and say, hey, why doesn't the governor know what's going on with COVID? Why doesn't he do something? Why did he blow off the Oklahoma Hospital Association 3 weeks ago when we knew this was going to happen? And say, hey, we're not interested. We don't need to worry about this. COVID is nothing. I'm paraphrasing some of the reports I heard from those requests, but that's exactly what happened. And so here we are 3 weeks later, and we're just trying to get a plan organized. So we're tier one. When we go to somewhere around 1,100 or so, I can't remember, we're 160 away, maybe less, from going to tier two. It's just a few hundred more patients to tier three, and then tier four, everything shuts down at a hospital level, which we don't want to get to. But remember, this is the beginning. This is not the end. This is the beginning of the COVID surge, which is what was expected from people who would talk about it. Unfortunately, people didn't in different positions. Maybe our state epidemiologist would have if he would have been a human one and not focused with excellent training in veterinary medicine and an excellent veterinary epidemiologist. But, having the only state with an epidemiologist for humans that's a veterinarian is a little embarrassing too. And yes, if I'm complaining about this, you should complain about it too. I mean, we're paying these people. They're not doing us a favor. Governor Stitt isn't doing us a favor. He works for us. I mean, he can talk and talk and talk and make up misstatements by accident, of course, but they're accountable. So call the office and say, Governor, why don't we have an epidemiologist that's trained? Why have you not taken advantage of the public health school at OU or the infectious disease doctors at OU? Let's try to get some expertise going. But what's happened now is it's too late, and now we're in reactive mode, and that's why I'm annoyed, because the whole goal of preventive medicine is to not get to this point. So we're here. So lockdowns aren't going to be that helpful. I think, yes, it's good to wear a mask, wash your hands, try to stay home when you can, but ultimately the virus is going to propagate because it's the season. It's when these cold viruses go, and so COVID's going to go more and more, and now influenza's going to go more and more. So there's going to be a fair number of people with cough, cold, congestion, influenza-like illness, but some of it's going to be COVID, some of it's going to be influenza, and then some subsets are going to go and get really sick. So that's what we're stuck with. So what do? One, understand that mitigation strategies, this is a take-home point. Understand that mitigation strategies are not therapeutic strategies. So what we were doing in March, which was we did late, but it still helped, isn't going to work now. It's not going to work the same. It is now the hot time. So mitigating doesn't work. The goal was to have therapies and things in place, but the FDA shut that down, as I told you. And so vitamins. Do your zinc every other day if you've been on it. Again, 50 milligrams if you're a bigger person, 30 milligrams if you're a smaller adult. If you have children, 15 milligrams. If they're like under 8, 10 milligrams. I always go with Flintstones for little kids. If you're having any problems with the zinc, just take a Flintstones. They may be hard to find now, which I hear all the time, like there's been shortages of zinc, but we still have zinc. Some stores still have zinc. Amazon still has zinc. There's places you can get zinc. I would be on zinc. I would be on vitamin D, 5,000 units every day. I would be on fish oil every day. I'd be on a multivitamin every day. I'd be on melatonin every day. There's other add-ons which I've gone over and over and over. So look those up and do it. That's what we need to do. You have to be on that stuff. I would try to limit your activities with large groups of people. I think that's smart. I think you want to make sure that if you're smoking, you're trying to smoke less. Try to eat better. Try to be outside. Sunlight's good for you and your immune system, but it's going to be a potentially difficult next 2 to 3 months. So my guess is we're going to surge up. It's going to peak probably in December, and then hopefully from there we'll start to come back down. But the next 4 to 6 weeks are going to probably be pretty tough. It could be longer, but at a certain point, I think it's going to get better, just because you have to go with some mathematical models. What are the mathematical models on the change or herd immunity? It's nothing to do with a vaccine, first of all. I mean, the vaccine to me is like the least important intervention. We have to go with, there's almost 9 million Americans who've been infected in a documented way. Again, we go with the different models. 8 to 10 times that number have been infected without being sick enough to get tested, or they never got tested, or they were asymptomatic. So figure we're 80 million or so in with infections. Infections give you immunity or a level of immunity for a while. To believe otherwise means the vaccine is useless, because the entire measure of the vaccine having any effect, and this is straight from the New England Journal of Medicine or New England Journal of Medicine paper from September 2nd, is does the vaccine give you neutralizing antibodies to the same level that illness does in people who've recovered. So if the vaccine's going to have any effect, we have to believe getting the virus had an effect, because that's what they're measuring the success of the vaccine is getting to a level of immunity sorry, that someone who's recovered has. So 80 million there. Figure 30% of the population has cross immunity at some level from the corona cold viruses in the past, because that's the standard blended rate across all the papers in the world, including the US paper. So 30%, so that's about 100 million. So we're at about 180 million. We need to get somewhere north of about 250 million or so, and we'll start getting some herd immunity. At the rate this is going, with 67,000 new cases yesterday, 63,000 the day before, we're booming and with the recorded cases. So, you multiply that times, 30 days, and, it starts being a lot of people. And so you multiply that times 60 days, and it's a humongous amount of people, and we're starting to get close to herd immunity. So by the time the vaccine comes out, I don't know how super important it's going to be, number one. Number two, any concept that they're promoting, which they already have begun, that if you choose not to do the vaccine because you've already been infected, you have side effects to vaccines, you just don't want to do it, it's okay. You're allowed to make your own decision about the vaccine. It's not immoral or wrong to decide this isn't for me, especially if you've already gotten the infection. It's just plain stupid. And if you've had serious reactions to vaccines. Plus, when do we take a vaccine that hasn't had a year or two of research? Never. So it's not immoral to protect yourself or your family. But that will be the messaging, because that's what the studies have shown: manipulation, guilt, guilt, guilt. You're a bad person if you don't get the vaccine. Now, on the other hand, if you feel like getting the vaccine isn't any big deal, get the vaccine. I'm not saying if you don't mind getting it, get it. It's fine. You can do what you want to do. But the rhythm of what I'm reading is, hey, we need to give you your antibodies up for 2 months, and then after that, we don't really know if it works. Even though there's no direct correlate to your vaccine antibody response and immunity, which has been shown in so many papers, you can't even talk about it for influenza vaccine. But so it only may last for 2 months to 3 months. So we may need to put you on every 3 to 6 month schedule, is kind of the hoofbeats I'm hearing. And so that could be something that comes out too. That's utter nonsense. If you're having to do a vaccine all the time to get some level of immunity, it's a waste of time. The other thing, because you can have reactions, plus it can give, as I've told you, diminish your immune response when you get it. The other thing, I can hear Gideon's deeply involved in a video game right now nearby. But the other thing, though, that's totally different is if the antibodies come out, like what Trump got, that are neutralizing antibodies that are just a shot and would give you 3 months or 6 months of protection, that's a totally different gig. If that happens, I'll let you know. It will obviously be all over the news. I think lining up to get a shot of gamma globulin, which is their immunoglobulins, and gamma is the kind that gives immunity or longer-term immunity. If they have manufactured one that is the neutralizing antibody to the spike protein, like the one they gave Trump, and it's shown to be effective, and you can get it, that's very safe technology. It's been around forever. It works. And so that's a totally different thing. So I think an antibody shot would be a great idea, very reasonable, very safe. A vaccine, until there's really excellent proof, would be very marginal. So that's our summary tonight. Any questions or comments that I need to answer, Kim?
I just had a couple. One person asked, with the cooler weather coming, is there a change that people need to make in their outdoor protocol?
No, not at all. I mean, you're
Start
out
wearing masks more often outside, any of that kind of thing?
No, not at all. I think you do your same old stuff.
Okay. Air purifiers. What do you feel?
If someone wants to use an air purifier, especially in the home, it's fine. I think air purifiers are probably more important in public places. We know the air purifiers and the HEPA filters on airplanes are highly effective of cleaning the virus. It's just, I don't know if it's super important in a home setting.
Okay, then interferon beta for COVID. What are your thoughts on that? And also, if you're already on it, are you more protected than if you're not?
So interferon beta is different than interferon alpha, but it's still similar. So it has its role is to reduce inflammation. You can get injections of it. It should in theory be protective. Okay, so sorry I was a little wound up, but I'm annoyed we're here after all this time to have had all this data gathered and then to put it in a box that we're not allowed to use to try to prevent people from getting sick, and anyone who does gets criticized and excoriated. So it's very challenging to watch this happen on a community and national basis. So hang in there, take your vitamins, and good night.